I got TB twice in my lifetime. I lost my husband and son to TB.
I'm a two-time intestinal TB survivor.
I'm the mother of Jackson, and we live here in America. Jackson was diagnosed with TB.
I'm a doctor and I have an occupational hazard of contracting TB all the time because I treat patients. And I did contract TB.
My husband diagnosed with TB in 1999 and he got TB in multiple part of body. It takes 3-4 years to diagnose.
Jackson had a fever around 3 months old that would not go away, and everyone thought it was just pneumonia.
When I got TB for the first time in 2007, my diagnosis happened nearly 4 months late. I was having acute stomach pain, vomiting, and weight loss, and especially fever in the evenings. Even then, my diagnosis happened almost 4 months later. The doctors were thinking I was having malaria or jaundice, but since none of the tests showed any signs of these diseases, finally I was diagnosed with TB. A big reason for this is that there is very little awareness about extrapulmonary TB.
After that, my son also got the TB. He had TB in kidney. When we went to doctors, all doctors said he has only diarrhea. So it will cure. Take some medicine, it will cure. But it takes 1.5 years to diagnose.
Diagnosing Jackson was so challenging because they had to stick the tube down his throat to collect the sputum. They did not sedate him because they were scared of the sedation because of how young he was. So they basically just did everything, and he felt everything. They whisked him away. I didn't want to be in the room because of all the screaming and the hollering that he did.
The testing for drug resistance, called as culture testing, the reports of the test took nearly 3 months to come. Now this time is really enough for a patient's life to go upside down. So let me tell you my case. When my bacteria was first given for culture test, and by the time I got my results, intermittently I had already had 2 or 3 surgeries.
Even though I had access to the best medical treatment in the country, the doctors could not locate where the TB was, and for those few months it was really difficult for me because I was having so many symptoms, and it was a very difficult time for my family too.
When doctors started the treatment for TB, it takes 1.5 months. The situation become more critical. His legs and hands become like a stick, and his stomach was so big, and he looked so ugly. I can't see my baby in pain. I lost him in age of 2.5 years.
This is 2018, and there should be an easier way to test for TB, especially in infants and in children, and it was difficult to diagnose him, and it shouldn't be like that, and it makes me upset that there is not a better way to diagnose it.
If we cannot diagnose TB quickly, we will not treat the disease quickly, and we will be saving that many less lives.